The next major category of problems in the shoulder that I see as an orthopedic surgeon are problems affecting the muscles and the tendons. Technically those are two different structures, but they work together, and most of the problems that we see related to those are treated the same way, so we're going to treat them as one group. There are a lot of different muscles around the shoulder. Some of them raise your shoulders up, some of them raise your shoulders down, some of them roll them forward, some of them roll them back, some of them raise your arm out to the side, some go forward, and some rotate your shoulder. The ones that we're going to focus on today are the rotator cuff tendons. Those are kind of deep in the shoulder, so it's hard to feel them from the outside, but they're primarily responsible for the rotation movements and raising your elbow out away from the side. There are four muscles and tendons that make up the rotator cuff. One in the front, called the subscapularis. It's deep down in the shoulder, so you can't feel it, but its job is to help bring your arm in this direction. So if your hand's out in front of you and you bring it across your body without moving your elbow, that's the subscapularis that's doing that. There's two in the back that are on the shoulder blade and a little bit lower down that help you rotate your arm out this direction. So they go the opposite direction from the subscapularis. That's the teres minor and the infraspinatus. The fourth one, and the one that's probably the most commonly affected of the rotator cuff, is the supraspinatus. That sits up here on the top back part of your shoulder blade, and its job is to raise your elbow out away from your side. So when you go up this direction, the supraspinatus is the one that's doing most of that work. So by identifying different movements that hurt, you can try to isolate which one of those muscles or tendons is causing the problem. There are common everyday things that you do that you may notice cause a lot of pain, and that can help you kind of figure out which one of these is most involved. So for the subscapularis, the one in the front, the motion of putting your hand back behind your back. So for men, getting your wallet out of your pants pocket or putting a belt on, that motion requires a lot of rotation inward using the subscapularis. For women, doing their bra is a common problem with the subscapularis irritation. The other direction, external rotation, using the infraspinatus and the teres minor, go in the opposite direction. That would be something like reaching up to get a seat belt to bring it across your body, or putting your hair up, brushing your hair, or shampooing your hair. That motion requires you to turn that arm out, and that's going to be the infraspinatus probably. The last one, elevating the arm out this way, that's the supraspinatus. So anytime you're trying to put something up above shoulder level, so putting dishes in a cabinet or getting something off of the high shelf in the refrigerator, those motions are going to put stress on the supraspinatus. And that's probably the most common one that we see. There is a fifth tendon in the shoulder that runs up and down this way, called the biceps tendon. It's not technically part of the rotator cuff, but it's a frequent cause of pain in the shoulder, and sometimes the motions that irritate the biceps tendon are very similar to some of the ones that will irritate the rotator cuff, so it's hard sometimes to tell the difference between the two. You can feel the biceps tendon if you're careful. You can put your fingers across the front of your shoulder and kind of feel around with your fingertips, and there's a little groove in the front of the shoulder that sometimes you can identify. And the biceps tendon runs up and down in that groove. So if you press on that area and it's very, very tender, that would indicate that the biceps tendon is pretty irritated. Now sometimes that can be the main problem, the primary problem, and sometimes that can be a secondary problem. When your shoulder's hurting and it's not working properly, you tend to compensate for it, and it's easy to get that biceps tendon to do more than its fair share, and then it gets irritated and inflamed. So sometimes it can be more than one problem at once.